We have been really happy having introduced the OxyGeneo to our office, and it is a comfortable procedure. My esthetician does all the work, so it's delegated, and it doesn't require time from me, which is wonderful because often you want to be able to do something else in the practice utilizing your staff as opposed to utilizing your own time. And patient satisfaction with it has been amazing because it sort of combines the effects of microdermabrasion with a facial, and depending on which procedure we're treating, we either use hyaluronic acid or kojic and azelaic acid. So I'll be able to give people this beautiful, soft skin immediately after the treatment. And I'll be honest, I was very skeptical of anything, as I am with any device. As an injector, I'm always leery to add any device to my office, and I have to see if it's going to work or not. So I tested it on myself before I decided to get the machine. And I thought, okay, how much can this thing really do? I mean, it's just a facial machine. What can it really achieve? And when I finished and I felt my skin, it's like, oh my God, it felt so smooth, my skin felt like glass. I thought, all right, if it can do it on my skin, which everybody so affectionately refers to as, the skin of leather, because I don't have the softest kind of skin, then I figured, you know what, patients are going to be happy. And patient satisfaction is well over 80–90%. Everybody that does it is happy with the results. Their skin feels better, whether we're doing the Bright or the Revive. The Bright will give that brightness to the skin that patients like, and the Revive gives that beautiful, soft texture that the patients love. And people are already booking, repeat treatments as soon as they come out because they just love it so much. Well, everybody's different as to how they like to do it. Some people like to do it every 6 weeks. Some people like to treat themselves, quarterly. Some people like to do it once a month. So it often depends on patients' lifestyles, right? How busy they are. Everybody's busy nowadays. But in terms of the recommended that we tell patients, we usually tell them about every 6 weeks. If they're able to make it in, then that's a good standard protocol for them. Mm-hmm. Oh my God, whenever I talk with my esthetician about the comparison between microdermabrasion and OxyGeneo, there is no comparison. We haven't even used our microdermabrasion since getting the OxyGeneo. It has really replaced the micro completely. And the comfort level, the OxyGeneo is much more comfortable than microdermabrasion. And you get a much better result. It just feels better. The skin feels better. It looks better. It's funny, we have a patient who is not old. She's in her 30s, and she did a treatment on the Friday. And then she came in to see me on the Wednesday or Thursday, I think, the week after. And I said, oh my God, your skin looks great. She goes, it's that OxyGeneo. You can't believe it. My skin looks amazing after using it. And, another one that she would, book repeated treatments because she just loved the results. So compared to micro, as I said, it's not even a comparison. I probably have a microdermabrasion unit for sale now. So. Most of my patients come for multi-treatment approaches here, whether it's going to be injectables, whether it's going to be laser, whether it's going to be the facials. But when it comes strictly to the oxygen facial or the OxyGeneo, we have it available to people just as the OxyGeneo is a facial by itself. Sometimes we'll combine it with my esthetician's, signature sort of classic facials. So one time she might do the Oxy, and the next time she might do a classic facial. Sometimes they'll do it in combination with other procedures, but it is nice because it does have that flexibility. You can do standalone treatment for patients that really have no interest in any other procedures, whether they think it might be too invasive or whatever. They don't want to do any other procedure, but they can do the OxyGeneo just by itself because they get great results just from that. Or for patients that are doing other treatments, it's sort of the icing on the cake that once they've finished all the other things, now they've got this beautiful skin after the OxyGeneo. I actually see the OxyGeneo as a final result as opposed to an introductory result. So sometimes when I do skin rejuvenation, I'm doing some damaging to the skin. So I don't usually do the OxyGeneo to prepare for the more aggressive treatment, I instead do the aggressive treatments first, then I let the OxyGeneo sort of do the icing on the cake or make the skin look and feel better after all the more potentially aggressive treatments have been done.
Mm-hmm.
Oh my God, that machine is amazing. I would strongly recommend it. As I said, I was majorly skeptical as to whether it does anything. And the funny thing is, because again, I am an injector principally, and we decided to look at what people were searching for on our website and what people are generally Googling. And the majority of people, I think the number one that people were looking at was laser hair removal, and number two was facials. Okay? So when they are looking for facials, over and above injectables, over and above skin rejuvenation, over and above anything else, the OxyGeneo, being a facial kind of procedure, is going to have high traffic to a practice that takes it. So yeah, I wouldn't go back. And the other thing, I am, for those that know me, I'm an incredibly critical individual. Okay? So companies are sometimes happy about hearing that, and companies sometimes really don't want to deal with my overly critical nature. But this has got to be the best looking machine that I have seen, because so many other machines are just aesthetically so ugly. And we are in a profession of beauty. We're in a profession of trying to make things look nice. And if you have this clunky, ugly, stupid looking machine, patients are not going to be as wowed as if they have this nice, slick machine in front of them that's easy to use, just looks beautiful. So, you know, you don't buy a machine for its looks, but the fact that it has that over and above the other things that it provides, it's just, again, the clincher as to making it a valuable asset to the practice. DermaSpark service has been excellent. I have been doing this for over a dozen years, and I've dealt with many suppliers, many providers, some of which, you know, I will not get into details, but leave a very negative taste in the mouth. DermaSpark has been fantastic from the get-go. They are attentive. They are concerned with providing the very best service, even on things that they're not responsible for. And, you know, without getting into details, they've gone above and beyond actually what would be expected. And there have been cases where I've had to ask some questions of them, which really they did not have any obligation to help me with. And not only did they help me, they took on any costs and time and things involved, all with no benefit to them. So, you know what, you don't really get a lot of companies like that nowadays. So, you know, Moshe and the whole team have been nothing but a treat to work with.